you like to know. It's called chemistry.
This is parkour.
Parkour!
Ladies and gentlemen, boys and girls, step right up, step right up. Come closer, you won't believe your eyes behind this curtain.
Hey friends. I am a first-year Doctor of Pharmacy candidate at Massachusetts College of Pharmacy and Health Sciences, where I will graduate in 2022 with my Doctor of Pharmacy degree.
Pharmacists dispense drugs and medication, advise patients about side effects, and regulate dosages of drugs.
A lot of being a pharmacist is you're the drug expert, you're the medication expert. So not only will patients come to you and ask you questions, especially at like a retail pharmacy like a CVS or a Rite Aid, but also if you're in a institutional setting like a hospital or a clinic, a lot of doctors, nurses, a lot of medical professionals will come to you for medication advice because you're the medication expert. So that all is based around understanding the chemistry of a drug. So a lot of pharmacy is understanding drug structures, because when you understand the structure of a drug, you have an idea of how it'll work on the body. So if you understand the different functional groups on a drug molecule, you'll understand a lot of how it works on the body. So being a pharmacist is having a general knowledge of all of the drug structures and knowing in depth and very detailed on how it works on the body.
Community pharmacists work with customers to fill their prescriptions, explain proper medication use, and provide clinical services. These pharmacists are often asked to give advice on diet, exercise, wellness, or stress management. Community pharmacists also advise doctors about medication therapy and help to identify possible drug interactions for people taking more than one medication. Some benefits include a lot of patient interaction and flexible hours.
Doctors, nurses, and patients rely on hospital pharmacists for important drug information. They work directly with doctors and nurses to make sure that each patient receives the correct medication in the right dosage at the right time. Hospital pharmacists also keep up-to-date records on each patient, which are used to fill medication orders and screen for drug allergies. In addition, hospital pharmacists may work directly with patients to be sure they understand their medications while in the hospital and when they are discharged to go home. Some benefits include interaction with other pharmacists and healthcare professionals and a fast-paced work environment with multiple responsibilities.
So as far as chemistry goes, in high school I took chemistry and AP chemistry, which really opened my eyes to the world of pharmacy and how much I really wanted to be a pharmacist. When I got into undergrad, I took 2 years of general chemistry, 2 years of organic chemistry, and then 2 semesters of quantitative chemical analysis, which is just the math behind what general chemistry is like. And then when I got into pharmacy school, I took 2 semesters of biochemistry, and now I'm currently enrolled in pharmacology/medicinal chemistry, which I'll take 4 semesters of in pharmacy school.
In order to become a pharmacist, you must obtain a license. To do this, one must complete an accredited PharmD program and pass 2 licensing examinations, the North American Pharmacist Licensing Program and the Multi-State Pharmacy Jurisprudence Exam.
The length of time to complete a PharmD program and begin practicing depends on the different program one chooses. Most standalone PharmD programs take 4 years to complete. If you complete a bachelor's degree before entering your program, it will take 8 years to become a pharmacist. Some PharmD programs accept students directly out of high school, and these programs take 6 years to complete.
Furthering their education, pharmacists can complete certificate training programs like those offered by the American Pharmacists Association, or they can pursue a graduate degree, such as a PhD in pharmaceutical sciences, an MBA, or a degree in public health. Pharmacists can also become certified through the Board of Pharmacy Specialties in an area of expertise like nutrition support pharmacy, oncology pharmacy, pediatric pharmacy, or psychiatric pharmacy.
When you graduate, you will get your Doctor of Pharmacy degree. After that, you can get a residency and work in a hospital, fellowship, at a pharmaceutical company that develops drugs, a retail pharmacy, or work with physicians and have a collaborative practice where you're seeing physicians' patients and helping them manage their medications.
The median yearly pay for pharmacists in the United States was $116,670 in 2012. The top 10% of earners in this field made more than $145,910, and the lowest 10% made less than $89,280 that year.
All in all, understanding chemistry is so important when understanding the therapeutic outcomes of drugs. Your experience depends on where you are.
It's a very small community of pharmacy, but it's a very large world of opportunities for you.